Hi guys, we'll be starting with another important topic, very interesting topic, that is toxicology. Fine. What is basically toxicology? Toxicology is a branch that deals with the poison. It deals with the source, the properties, the mechanism of action, signs and symptoms, and diagnosis and management. In short, it is about everything about poisons. Okay. As a medical student, why should you learn about toxicology? See, acute poisoning is basically a medical emergency. This poisoning case, this is basically a very significant cause of morbidity and mortality, not only in India but also worldwide. Okay, it may be accidental poisoning, it may be suicidal poisoning, it can also be homicidal poisoning. Particularly if we talk about suicidal poisoning, this is the second most lethal cause, poisoning. Okay, so in this unit, we'll be learning about each poison, the properties, the clinical features, the management, and the medico-legal importance of each poison. By the end of this particular unit, toxicology, I'm sure that you all will be having one comprehensive idea about the management of each poison at different level, primary, secondary, and tertiary healthcare level. Okay, so let's start with that. Fine. Now let's see the basic terms. The first term is forensic toxicology. What is forensic toxicology? This is basically the medico-legal aspects of poison, which means it is about the medico-legal reporting in a poisoning case. It is about the gastric lavage procedure, post-mortem findings, and what are the samples that are to be preserved while you do dissection in a case of poisoning. Okay. The next term is about occupational toxicology. What is this occupational toxicology? See guys, certain poisons will be specific to each occupation. For example, let us say a person working in battery manufacturing company is more prone to get lead poison. A person is working in mining industry, the person is more prone to get arsenic poisoning. So it is the study of toxicology, study of poison in relation to any occupation. In relation to specific occupation, we call it as occupational toxicology. Fine. The next one is your ecotoxicology. What is that ecotoxicology? When you study the poison in relation to environment. When you study the poison in relation to environment, the ecological aspects of the poison, then it is called as ecotoxicology. Fine. We learnt about toxicology, we learnt about forensic toxicology, eco and occupational toxicology, everything we learnt. Let's have a definition of poison. What is basically a poison? Poison is any substance. It can be any substance, right? Given in any form. When I told you any form, it can be a solid, it can be a liquid, it can also be a gas. Given in any route. It can be oral, it can be IV, it can be injection, it can be inhalational, it can be brought in contact with the body, can cause ill health or death by its local or remote action. It can cause local action or it can be absorbed into the body. It can cause remote action as well. Okay. This is the complete definition of poison, where any substance, any form, any route, it can have ill effect or death, or it can cause by its local or remote action. But when I tell you that it can be given any route, you can see that this poison will be having the rapid absorption when it is given inhalational. The rapid onset will be with inhalational, followed by IV, followed by IM. Okay, they can ask you which route is having the rapid absorption. Do remember that it is inhalational. Okay, fine. So this is poison. Fine. When we talk about poison, but there is one more terminology that we have to know, that is drug. So what is basically the difference between the poison and drug? Okay. See, there are two ways that you can differentiate. Before learning that, you need to know this important quote, that is sola dosis facit venenum. What does it mean? See, the dose makes the poison. The dose makes the poison. All the things are poison. There is nothing which is not a poison. Solely the dose differentiate a poison from the remedy. Solely the dose differentiate the poison from the remedy. Right? If you given in lower dose, it will cause a healing effect, that is drug. If you given in higher doses, it can cause toxic effects, then it is called as poison. Okay, so you can differentiate the poison and the drug based on the dose medically. But when we say legally, it is with the intention that it is given. If it is given with the intention of healing, then you call it as drug. If it is given with the intention of doing harm to a person, then you can call it as poison. Okay, so you can just broadly differentiate in two aspects. One, it is the dose that is given. Another one, it is the intention with which it is given. Okay, so this quote is given by a famous person in toxicology. He is none other than the father of toxicology, Paracelsus. Right? He is the father of toxicology. There is one more pioneer that we have to know here. He is Matthew Orifilla. He is the father of modern toxicology. Matthew Orifilla. He is the father of modern toxicology. Modern toxicology. Fine. So Paracelsus was the father of toxicology. Matthew Orifilla was the father of modern toxicology. Okay, fine. So now we have to learn the difference between the word poison, toxin, and venom. Right? Though these terms are looking very different, but let us have a complete understanding about it. We discussed about poison, but what is basically a toxin? Toxin is any biological substance. Toxin is any biological substance produced by a living organism. Produced by a living organism. When I say living organism, do remember, guys, it is about a plant or animal. It can be a plant or it can also be an animal. It can be a phytotoxin produced by a plant. It can also be an animal toxin. Animal toxin, for example, you can think of a venom produced by a snake, or it can be scorpion. Fine. Toxin. The study of toxin is called as toxinology. The study of toxin is called as toxinology. Fine. Okay. Fine. The next important thing is your venom. Let's talk about venom. What is basically a venom? Venom is a biological substance. Venom is a biological substance. It's a toxin. It is a toxin produced by an animal. Produced by an animal. It is usually a proteinaceous substance which is injected into the body. It can cause ill effects. Example is snake venom. The study of venom is called as venomics. Study of venom is called as venomics. Fine. So broadly we can say poison. A subgroup of poison is toxin, under which you have another subgroup that is venom. Okay. Few years back in INICT exam, you got a question on this. Which of the following is not a toxin? Abrin, resin, croton, arsenic. Right? Arsenic is poisonous. Arsenic is toxic, but it is a chemical. It is not a toxin. Okay. Arsenic should be chosen in that. Okay, so before learning about, we have discussed about important terms that we have to know before starting with toxicology. But even before going to individual poison, there is one important area that we have to learn, that is about the classification of poison. Why this classification is so important, guys? Do remember, classification is something where it gives you a broad idea about each group. Okay. It will give you broad idea of each group of poison so that you will understand the basic properties of each group and basic management of it. Okay, though you have a long list of poison, all the poisons can be broadly categorized into one important word that you have to remember, that is SYNCAM. Right? What is SYNCAM? Every letter indicates one specific group of poison. Okay, 6 letters. SYNCAM, which every letter will indicate one specific group. The first letter C means corrosives. Any substance that corrodes called as corrosives. Any substance that corrode called as corrosives. Fine. The next group is I for irritant. What is that irritant? Any substance which causes inflammation. Any substance which causes inflammation, that is called irritant. The next letter is N for neurotoxic. Any substance which is acting on the nervous system, it is neurotoxic. It can be acting on the central nervous system. It can also be acting on the peripheral nervous system. The next letter is cardiotoxic, acting on the heart. A for asphyxiants. All these are basically gases. Do remember, friends, all these are gases. The next letter is M for miscellaneous, which includes agricultural poison, food poison. Everything will be discussed in miscellaneous groups. Okay, so do remember the 6 groups we have got, which can be remembered by the mnemonic SYNCAM. Out of all the groups, 6 groups, if they ask you which group gives you the maximum tissue destruction, if you put something, locally, which groups gives you the maximum tissue destruction, the maximum tissue destruction is given by the group that is nothing but corrosives. Okay, so let us have something in detail about each group. Fine, let's see something in detail about each group. Let's start with corrosives. First group, I told you this is the group which can give you the maximum tissue destruction, and this is the one which can corrode. It can corrode. We have two subgroups on it. Number one is it acid. Number two, it is alkali. We are not going to discuss in detail about acid or alkali, which will be dealing when we are discussing about the chapter corrosives. Now I'll tell you the broad outline. Corrosives, two broadly categorization. One is acid, another one is alkali. The next group is irritant. Irritant. I told you anything which can cause inflammation, that is called irritant. Fine. Anything which can cause inflammation, that is called irritant. Fine. Under which we have got 4 subgroups are there. Number 1, it is non-metallic. It is non-metallic. Metallic. All the metals. Right? We have got a long list, but we are not going to discuss all the metals which are there. We are going to discuss the most important metals alone. Then we have got plant irritants. We have also got animal irritants. Plant irritants and animal irritants. Okay, let's discuss what are the examples. The most important example for non-metallic irritants is phosphorus. Phosphorus, very commonly known. Fine. What are the other examples? You can think of iodine, chlorine, bromine. All these are non-metallic irritants. Okay. Metallic irritants. Metallic irritants, you can think of arsenic, mercury, lead, iron, copper, cadmium, thallium. These are the common metals that you will be getting MCQs on. Okay, so these are the metals that we'll be discussing in detail when we discuss metallic irritants. Plant irritants, whatever that you commonly see as a plant irritants. Number 1, Ricinus communis, Abrus precatorius, Semicarpus anacardium, Croton tigilium, Capsicum annum, that is nothing but your chili, Capsicum annum. Okay, and your Calotropis, which is very, very commonly seen among, right? You can see it on the roadside. Fine, Calotropis. All these are plant irritants. Animal irritants. What animal irritants we've got? Snake. We have got snake bite. We have to learn about scorpion sting. We should also be learning about spider bite. Recently, in one of your exams, you got a question on spider bite as well. Honeybees, centipedes, all these are animal irritants, right? Which may produce venom. That it is injected, it can cause ill effects. Okay, right. Let's move on to the third group. The third group of poison is called as neurotoxic. Neurotoxic. Fine, right. Acting on the nervous system. When we say nervous system, it may act on the central nervous system, or it can be acting on the peripheral nervous system. Peripheral nervous system. So let's discuss one by one. Right. Neurotoxic for central nervous system. When I say central nervous system, it can act on the brain. It can also be acting on the spinal cord. Right. So let's see the poison which acts on the brain. You can remember the poisons, cerebral poisons. You can remember the cerebral poisons based on the action which is causing it. Suppose if any poison is causing sleep, we call it as somniferous poison. Somniferous. Somna means sleep. So this is somniferous poison. Right? Under which we'll be learning about opioids. Somniferous poison. Okay, somna. The next thing is the poison can act on the brain. It can cause stimulation. On further stimulation, excessive stimulation, it can cause delirium. Any substance, any poison which can cause delirium, you can consider that under the group delirium, wherein we'll be learning about datura, cannabis, cocaine. right? These are the common deliriums we'll be dealing in day-to-day practice. Then we have got inebriants. What is that inebriant? Any substance which causes intoxication. Any substance which can cause intoxication, we can say that it is an inebriant. Any substance which can cause intoxication, we can say that it is inebriant. Right? Number one, it is alcohol. Number one, it is alcohol. Right? Not only alcohol, we also have what is called as chloral hydrates. Chloral hydrate is another important example of inebriant. Okay. Then a poison acting on the brain can also cause stimulation. The person get excited. Right? What are the drugs that comes under? What are the poisons which come under stimulant? Number one, caffeine, cocaine. Cocaine can also be dealt under delirium. It can also be dealt under stimulant because the basic action is same. Amphetamine. Amphetamine. Okay, so that is stimulant. Then we have got psychoactive. Psychoactive. What is that? Cannabis. We have got cannabis. We also have what is called as phencyclidine, which is commonly called as angel's dust. Right? We'll be learning all that in detail. For now, we just need to know like which poison can be brought under which group. Okay, so if you remember, I told you that we have got somniferous poison, we have got delirium poison, we have got inebriant, we have got stimulant, we have also got psychoactive. So all these are dealt under cerebral poison. Now coming to the spinal poison. What is that spinal poison? When we say spinal poison, do remember the first important thing that we have to learn is Strychnos nux vomica. Right? Everybody knows that Strychnos nux vomica is a spinal poison. No doubt about that. Okay, we know that Strychnos nux vomica acts on the spinal cord. Fine. But there is one more important poison that we have to know under this is gelsemium. Right? Gelsemium is also important spinal poison. 2 years back, again, in one of your initiate, you got a question on this. Spinal cord is preserved in which of the following poisoning? Right? People were searching for Strychnos nux vomica, but Strychnos nux vomica was not given in the option. Instead, gelsemium was given in the options. So you need to remember, guys, gelsemium is also important spinal poison. Right? But the action differs. Though you have Strychnos nux vomica and gelsemium, do remember, guys, Strychnos nux vomica acts on the spinal cord. It causes excitation. It causes spinal excitation where the person will be having a lot of convulsions. Whereas gelsemium, remember friends, it does not cause CNS means spinal excitation. It causes inhibition of the spinal cord. Right? The action differs in both. Okay, fine. So if they ask you, if they give you any of this poisoning and if they ask you which organ to be preserved, you obviously have to know that spinal cord has to be preserved because it acts on the spinal cord. Okay. Now moving on the peripheral nerve, wherein one important plant that we have to learn here is conium maculatum. Conium maculatum. What is that conium maculatum? The common name of this conium maculatum is hemlock. Right? This hemlock, Socrates, he died of this conium maculatum, hemlock, okay, which acts on the peripheral nerve. Not only that, you can also have other examples like curare, which also acts on the peripheral nervous system. Okay, so we discuss in detail about the poison acting on the nervous system. So we have discussed about neurotoxic poison. The next letter in the SYNCAM group is C. The letter C for cardiotoxic poison, cardiac poison. As the name implies, it will be acting on the heart, right? It will cause cardiac arrhythmia most commonly. We need to know what are the cardiotoxic poison. For that, you can remember the mnemonic cardona. Cardona. What is a dona? D-O-N-A. What is a dona? These are the cardiotoxic plant. Okay. D-O-N-A. D for digitalis. D for digitalis. You know very well that's foxglove. Right. O for oleander. It can be pink oleander. We also have yellow oleander. We'll be discussing that in detail. The letter N for nicotine. The letter N for nicotine and the letter A for aconite. The sweet poison, aconite. We'll be discussing on that. Okay. Nicotine is nothing but tobacco. So DONA, digitalis, oleander, nicotine, aconite. All these are cardiotoxic plants which may cause cardiac arrhythmia. Patient may die. The next letter in SYNCAM is A. What is that A? A for asphyxiants. We have already learnt about the asphyxia. We have discussed about mechanical asphyxia, right? See, any substance, any poison which induces asphyxia, we can call it as asphyxiant. And do remember, most of these poisons are gas. All these are gas. Okay. Depending on the action, depending on the toxic activity, you can broadly categorize into simple, chemical, right? Simple, chemical, and irritant. Simple is something called inert. It doesn't act chemically. Right? Chemical asphyxiant is something where it interacts with the cell, then it causes asphyxia. Irritant is something which has got mostly irritant action, nothing more than that. Okay, let us see the examples of it. Simple, carbon dioxide. Carbon dioxide, inert gas. Okay, in addition to that, we also have nitrogen and other gases like helium and all these are inert. Okay. Now chemical, what is that chemical? Chemical is carbon monoxide, hydrogen cyanide, hydrogen sulfide. All these are chemical asphyxiant. Right? And then irritant. What is that irritant? Chlorine. Right? MIC. What is that MIC? Methyl isocyanide. Ammonia. Ammonia. Right? All these are irritant gas. Irritant gas. It can cause irritation of the respiratory tract. It can cause irritation of the eyes. Okay, depending on the place of exposure, it can cause irritant symptoms. Okay, right. So we have finished asphyxiants. M for miscellaneous. The next letter in SYNCAM is called miscellaneous. M for miscellaneous. Right. So whatever you have not discussed so far, you will be learning on that. Okay, fine. The example of miscellaneous, number one, here we'll be learning on agricultural poisons. Under agricultural poison, we have got multiple subgroups on it. What are they? Number one, insecticides or pesticides. Insecticides. Right? We have got mosquito repellents, wherein all your pyrethroids will be dealt under repellents. Okay, and we have also got rodenticide, rat killers. Rodenticide. All these will be dealt under agricultural poisons. Then apart from that, we will also be learning on food poison under miscellaneous. Food poisoning. Right? So these are the broad groups we have got under SYNCAM. Okay, so when you know which group the poison belongs to, we can understand the general properties of each poison. We can also plan for the management. Okay, fine. Yes, friends, we'll be talking about the next important group, that is your diagnosis of poisoning. If a patient has come to you, or if a dead body is brought to you, how do you know the person was suffering from poison? Diagnosis of poisoning. This particular diagnosis of poisoning can be dealt under two broad categories. Either the person is alive, diagnosis of poisoning in case of living, diagnosis of poisoning in case of dead. That means while you do autopsy, how do you know the person died of poisoning? Right? We'll be discussing under two broad groups, in the living and in the dead. Fine. Now let's talk about living. In case of living, you can find out first from the history itself. Right? History given by the patient, or history given by the relative, or history given by the police. Okay. The symptoms. If the symptoms occur sudden onset in an apparently healthy person, he was apparently healthy, the symptoms occurred suddenly. And particularly the symptoms, it is uniformly progressive. It is increasing, progressive. And particularly if the symptoms occur just after food intake. After food intake. And one more important clue about poisoning is when several members in the same family suffering from the similar symptoms. Several patients of the same family who ate. Several members of the same family who's suffering from the symptoms. In all these situations, we can suspect, in all these symptoms, we can suspect about poisoning case. Fine. So this is the history. How do you identify poisoning based on the clinical features? When you see the clinical features of the patient, right, mostly you can understand the type of poisoning based on certain important vital parameters itself. You can talk about the blood pressure, heart rate, temperature, pupil status. So these are all the important features that will be given in the question also. Right, based on that you can find out what poisoning itself. So this is one important group that we have to know. This is one important discussion that we need to have, right? What is called as toxidromes. Toxidromes. What is toxidrome? This is a collection of findings, collection of signs in a particular patient suggestive of one particular group of poison. This is called toxidrome. We have specific lot of toxidromes are there, but traditionally, conventionally, you have 5 important toxidromes. What are they? Number 1, cholinergic toxidrome. Cholinergic. Second one is anticholinergic. Cholinergic toxidrome. We have anticholinergic toxidrome. You have sympathomimetic toxidrome. Sympathomimetic. Sympathomimetic. Opioid. We also have what is called as sedative hypnotic toxidromes. Sedative hypnotic, right? These are the 5 common. Traditionally we have these 5 common toxidromes. In addition to that, we also have other toxidrome, but these 5 are very important for your examination purpose to solve the MCQs as well. Not only that, even your clinical practice, whenever you see any patient with that particular group of finding, you can easily find out that which group of poison he must have consumed, and you can treat the patient accordingly. Right, fine. So let us have a discussion on that. Let's start with each group. And one more important thing is, when you talk about the opioid toxidrome and a sedative hypnotic, both are very similar. So now I'll be telling you about the 4 important toxidrome. Number 1, I told you that based on the clinical features. When I say clinical features, what are the findings that you will have to see in the patient? Now let's start with the most important one, heart rate. Right, heart rate. If the patient has come with cholinergic toxidrome, do remember it is cholinergic toxidrome, the heart rate will be reduced. Fine. Blood pressure will be reduced. Fine. What about sweating? The skin. When you see the sweating will be profuse. There is excessive secretion. There is excessive sweating. Okay. Then you talk about temperature. Right. In cholinergic toxidrome, the temperature will be reduced. Patient will be having hypo. Temperature is reduced. Look at the pupillary status. Pupils. In cholinergic toxidrome, you know very well, guys, it is pinpoint, constricted pupil. Pinpoint pupil. Not only that, you should also look at the CNS. Right? CNS. When you look at the CNS feature, the patient will be maybe having convulsions. He may be comatose. Convulsions or comatose. Coma. Fine. What are the other features that you can see here? What are the other features? Other features that you can see is, you can see the bowel sounds will be increased. The GIT motility will be increased. GIT motility will increase. One most important thing is, you can see that there is excessive secretions throughout the body. Right, there's excessive secretions throughout the body. If you find any patient with all these features, you can easily say that the person is suffering from what is called as cholinergic toxidrome. What are the examples of cholinergic toxidrome? What are the poison that can cause cholinergic toxidrome? Number 1, and the most important one, is your OPC poisoning. Right, you can also think about carbamide, but OPC is the most commonly seen poison, wherein you can talk about this cholinergic toxidrome. You can easily diagnose without any difficulty at all. Okay. Now moving on to anticholinergic toxidrome. Anticholinergic, it will be exactly opposite. Anticholinergic toxidrome. Fine. So you know very well, in case of anticholinergic toxidrome, the heart rate will be excess, tachycardia, it is increased, blood pressure will be increased, sweating will be completely dry, totally dry. That is one important classical feature of cholinergic toxidrome. Okay, right. Look at the temperature. Temperature will be increased. Okay, pupils will be completely dilated. Mydriatic pupil. The patient will be having delirium. Patient will be having delirium because it causes stimulation. The patient will be having delirium. The patient will also be present with what is called as hallucinations. Okay. What about the other features? When you talk about the other features, the bowel sounds will be completely reduced. One important feature that you can see in the question is they would have given you about urinary retention. The patient will have urinary retention. And all the secretions will be totally dried. I've told you here itself, all the secretions will be totally dry. Okay, fine. So if you see these features in a patient, the patient is suffering from anticholinergic toxidrome, and the commonest example that you can think of is nothing but datura, atropine. Not only that, sometimes the patient may also have these kind of features with tricyclic antidepressants, antipsychotics. All these drugs can cause this anticholinergic toxidrome. Do remember, all the vitals are increased. Look at the secretions. Secretions are totally dry. Okay, pupils are dilated. I've told you two important toxidromes so far. Let's look at the third important toxidrome. The third important toxidrome is your opioid toxidrome. Opioids. Fine. Opioid toxidrome. Look at the heart rate. Heart rate will be reduced. Okay. The blood pressure will be reduced. Secretions, not much of effect. Temperature will be reduced. The patient will be hypothermic. The pupils will be typically pinpoint. Pinpoint pupil. Okay, pinpoint pupil. What about the CNS status? Patient will be in comatose situation. Patient will be in coma. Fine. Patient will be in coma. You look at the other features. Patient will be having respiratory depression. Right? Respiratory depression. Do remember, friends, if a patient is suffering from these kind of features, patient is suffering from opioid toxidrome, do remember the most important thing that we have to think of is morphine. Other opioids will also cause similar feature, but most important poison that we have to think of is morphine, particularly if the patient is having these three features, a triad of pinpoint pupil, respiratory depression and coma. We can always think about it is a triad of morphine poisoning. Okay. The next important toxidrome is sympathomimetic toxidrome. Sympathomimetic. When I say sympathomimetic, guys, it means that it increases sympathetic system stimulation, right? When sympathetic system is stimulated, what happens to the heart rate? Heart rate will be increased. Patient will be having tachycardia. What happens to the blood pressure? Patient will be having hypertension. BP is increased. What happens to sweating? Sweating is increased. Profuse sweating. Okay? Profuse sweating. And what about the temperature? Temperature will also be increased. Pupils. This is one important question that many times it is asked in the exam. Pupils will be mydriatic. It is dilated. It is mydriatic. Okay, it is mydriatic. Patient will be hyper alert. Sometimes it can cause convulsions. If the dose is excess, it can even cause convulsions. Other features, they may give you tremors in the question. So if you find any of these features, if you find these features in a specific poison, you can easily think that the patient must have consumed any sympathomimetic poison. What is a sympathomimetic poison? You can think of cocaine. One common question asked in the exam. Often you can get this in the exam. Cocaine. You can also think about amphetamine. Okay, cocaine, amphetamine, and theophylline. Right, these are the substances which can cause sympathomimetic effect. Okay, so this is one important area that you have to be familiarized with. I have told you just 4 important group. One is cholinergic, anticholinergic, opioid, and sympathomimetic. Right, I have given you the features also. If they give you this case-based question, A patient has come with unknown poisoning present with all these features. What is the probable poison he must have consumed? A patient has come with unknown poisoning presenting with all these features. What is the probable antidote that you will give? You should find out which poison it is, and you can find out what is the antidote for that. Okay, so you can solve this kind of clinical features question based on this one particular area, that is toxic. Okay, apart from this clinical features, what else you can do in a patient to find out poison, to diagnose poisoning? You can do lab investigations, you can do lab testing, you can use blood analysis, you can also use urine analysis, particularly if the patient has got urine sample and the urine sample is showing oxalate crystals in the urine, then it must be due to oxalic acid poisoning. It can be due to oxalic acid poisoning. Not only that, it can also be due to ethylene glycol. Do remember, most of the times in the exam, they can give you any of this in the exam. Okay, it can be a patient has come with unknown poisoning. You check his urine is showing multiple oxalate cast. Then you can think of oxalic acid poisoning. Not only that, you can also think of ethylene glycol. Remember, these two poisons very important for examination purpose. Okay, right. Moving further, what are the poisons which acts on the kidney, which are toxic to the kidney? You can see poisons which is causing PCT necrosis. You can just think of PCT itself. I'll use PCT necrosis, drugs, poisons which can cause PCT necrosis. I'll give you the list with the mnemonic PCT itself. Right? The letter 1, P, phenol, right, can cause PCT necrosis. Phenol. Now we'll be seeing another interesting area, that is the difference between ideal homicidal poison and ideal suicidal poison. If you kill a person by poisoning, what are the properties that you would expect the poison to be having, and what is your choice? Otherwise, if the person commits suicide by a poison, what are the poison the person would choose, and what are the properties he would expect the poison to be having? So we'll discuss something relevant to that. Let us say that you want to kill a person by giving a poison. Which poison that you would choose, and what are the properties you would expect the poison to be having? First one, the property. The poison you would choose, it should be colorless, so that you can mix it with anything, it will not change the color. It should be odorless, so that the person will not find out the smell of it. And it should be tasteless, so that the person will not be able to identify the poison mixed in the food or drink. Okay. And what about the cost? Should be cheaper. Onset of symptoms. And many a times you might think that the person should die immediately after taking the poison. Okay, but do remember that is not a great idea. But because when you give a poison to a person consumes it, person dies immediately, you would get caught. Red-handed. Fine. So it should start after a delay. Right? It should produce, the onset of symptoms should be delayed, so that you will have some time to escape. Okay, fine. And what about the nature of symptom? The nature of symptom should be resembling natural disease, so that the person will not suspect that he is being poisoned. It should resemble natural disease. Fine. And let us say the person died. You do autopsy. What about the post-mortem findings? If a poison is if the poison is producing any specific post-mortem findings, then you can easily identify. So ideally what happens, the homicidal poison should not produce any kind of specific symptoms, specific findings. Right? It should not produce any specific post-mortem findings. Then only it will not be identified. And what about the lab test? When you do any lab test, the ideal homicidal poison should not be identified. It should not be detected. It should not be detected in the body. It should not be detected by any lab findings, so that the person will be escaping. Fine. So these are the properties of ideal homicidal poison. And if you talk about the examples of ideal homicidal poison, do remember there is no absolute homicidal poison. There is no absolute homicidal poison. There are few poisons which might be having most of the properties of what we have discussed so far. For example, you can say thallium. Thallium satisfies some of the properties of this homicidal nature. Okay. That is the reason why this poison, thallium, is called poisoner's poison, right? Poisoner's poison. Okay. Apart from thallium, you can also think about arsenic. You can also think about aconite. These are all the examples of homicidal poison. We cannot say ideal homicidal poison. We can say near ideal homicidal poison. There is no ideal homicidal poison. We have discussed about homicidal nature. Let's talk about suicidal nature. Okay, if somebody wants to consume poison, what is the poison the person would choose and why he would be choosing it? What properties will make him to choose it? Let us talk about the property. Color doesn't matter. Odor doesn't matter. Taste, we can say that should be of pleasant taste. We cannot say sweet, we can say pleasant. It should not be irritating or it should not be painful. It should not be painful. Cost doesn't matter. Onset of symptoms, it should be immediate, faster onset. There is one important feature. That will make a person to choose the poison for suicidal nature. For what is that? It should cause painless death. This is the single most important feature everybody would think of choosing a poison for committing suicide. It should cause painless death. It should cause painless death. Other features like postmortem findings doesn't matter. Lab test doesn't matter. What is the example? Example, the ideal homicidal poison, we can say ideal is cyanide, right? Because it causes most rapid death. Apart from that, you can say examples of ideal homicidal poison. You can say organophosphorus compound, very common. Apart from that, you can also say aluminium phosphate, which is very commonly used in North India. Okay. You can see opium, opioids. All these are used for suicidal tendency, right? All these are used for committing suicide. Fine. So I've told you the properties of ideal homicidal poison. I've also told you the properties of ideal suicidal poison. Fine. And as I told you earlier, there is no ideal homicidal poison exactly available. You can say some of the poisons which might satisfy properties of homicidal nature. Okay. We discussed about diagnosis of poisoning in case of living, right? So now we'll be discussing about diagnosis of poisoning in case of dead people. Means what? While you do autopsy, how would you know which poison he has, whether he has consumed poison or not? If he has consumed poison, which poison he has consumed? So all these things we will discuss now. One important thing is while you do autopsy, some of the findings like the smell, the color of hypostasis, right? Not only that, you can also look at the color of stomach mucosa. All these findings will tell you a clue related to the poison. Okay, fine. Apart from that, in addition to these findings while you do autopsy, during autopsy, you can also preserve some samples, tissues and send it for analysis. We call it as chemical analysis. We can do what is called as chemical analysis and we can find out which poison he has consumed. Okay, so you can broadly categorize diagnosis of poisoning in case of death into these two important headings. Right, so let us discuss one by one. Let us start with the smell of poison. Then we'll be discussing the color of hypostasis, stomach mucosa. Let's start with the smell. Right, number one, smell. Right. There are few poisons which have got specific smell, and if you want to perceive the smell of poison, do remember we should always open the cranial cavity. We have discussed this important point when we discussed about thanatology. Fine. Right. So we open the cranial cavity. What are the poisons that we can find out? Okay. Right. Number one. We'll talk about that. Number one. Cyanide. What is the smell of cyanide? It is oil of bitter almonds. Oil of bitter almonds. That is the smell of cyanide. Okay, right. What is the smell of cannabis? Cannabis has got a smell of burnt rope. Right, they used to rope cannabis, the street name is rope, right? So people used to smoke it, burning and smoking, burnt rope. Okay, marijuana will be having burnt rope smell. Okay, right. What about hydrogen sulfide? Hydrogen sulfide has got a smell of rotten egg. Rotten egg. In addition to hydrogen sulfide, even disulfiram will also having rotten egg smell. But what is most important for examination purposes, you can think of hydrogen sulfide. Okay. What about alcohol? Alcohol, you know very well, it has got fruity odor because alcohol is produced by fermentation process. Fermentation process, that's why it has got fruity odor. Okay. Chloral hydrate. Chloral hydrate. It has got a smell of acrid pear. Acrid pear smell. In addition to, say, chloral hydrate is one of the inebriant. I told you in classification. We'll be discussing in detail about chloral hydrate. Chloral hydrate has got a smell of acrid pear. In addition to chloral hydrate, you also have peraldehyde, which is also having the smell of acrid pear. Peraldehyde. Fine. Okay. Now moving further, what is the smell of organophosphorus compound? Organophosphorus compound has got a smell of kerosene. Kerosene. There are few poisons which have got garlic odor. What are they? Number one, phosphorus has got garlic odor. Arsenic poisoning, patient will also be showing garlic odor. Okay, remember phosphorus and arsenic, garlic. In some of the cases, what happens is even OPC poisoning may also be having garlic odor. Right, that is because of the presence of phosphorus group in organophosphorus compound. Organophosphorus compound, because phosphorus is a garlic odor, you can remember some of the cases where the OPC poisoning will also be having garlic odor. But typically if they ask you, you need to remember it is a smell of kerosene. That is because they add in OPC compound, insecticide, they add a compound called Aromax, which is a petroleum product. The addition of petroleum product Aromax in OPC compounds makes us smell kerosene. Okay, ideally you need to think of kerosene, right? Sometimes you can also be getting garlic odor. So in the question, if they ask you, patient has come with unknown poisoning, having the smell of garlic, presenting with symptoms, okay, like salivation, lacrimation, urination, you always should think about OPC poisoning. Just because of the smell garlic, don't think it may not be OPC poisoning. When you think of other features like salivation, lacrimation, urination, in addition to garlic odor, you can always make a diagnosis of OPC poisoning. You can treat accordingly by giving atropine and pleurodoxime. Right? Okay. Right. Moving further, you can... I told you about conium maculatum. What is this conium maculatum, friends? Conium maculatum is also called as hemlock, which I told you in peripheral nerve poison. This conium maculatum has got a smell of mousy. It has got a smell of mousy odor. Mousy. Okay, fine. Then sometime they can ask you salicylates. Salicylates. Oil of wintergreen. Oil of wintergreen. Okay, so these are the poisons which are got the specific smells, and these are the important poisons, right, which you need to know for the exams. Okay, I told you one is smell. Second one is hypostasis. Second one is hypostasis. Let's talk about hypostasis color. You know very well, friends, what is the normal color of hypostasis? The normal color of hypostasis in a patient is blue. That you know. But certain cases, the color of hypostasis will differ. We'll talk about that. Number one, if it is carbon monoxide case, the color is cherry red. Okay. If it is cyanide, you get a color of brick red or bright red. Brick red or bright red. Okay. Dark brown, you get that in phosphorus. dark brown. You get that in phosphorus. Sometimes you get another brown, that is your chocolate brown color. Chocolate brown color is found in multiple conditions. For example, you can get that in bromide poisoning. You can get that in aniline. You can get in nitrates. Okay, so these are the places where we get chocolate brown color. Sometimes what happens, in some of the textbooks they also mention aniline deep blue, right? Either you get deep blue or chocolate brown. If you get aniline in the option, you always have to choose aniline among the options. Okay, fine. How can you remember the chocolate brown? You can remember the mnemonic BAN, 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 right? So you can think about, when you get BAN poisoning, you always think about chocolate brown in color, chocolate brown. Okay, then we have hydrogen sulfide, which have got a color of bluish green. It's not just green, it is bluish green. Patient has come with unknown poisoning. Patient died. During autopsy, you can look at the hypostasis to be bluish green in color. What is the probable poison that you would have died of? You always have to think hydrogen sulfide. This is one very important point that you have to remember, which have been asked multiple times in your exam. Okay. Then you can think of opium. Opium, we get black color hypostasis. Black color hypostasis. Methanol, purple. Methanol, it is purple. Okay, so these are the common colors that we will have to know with regard to poisoning case. We have discussed about the smell, we have discussed about the hypostasis. The third important thing is by looking at the stomach mucosa. Whenever you dissect stomach in a poisoning case, during autopsy, make sure that you preserve the stomach. You should also preserve the gastric content. Okay, gastric content is an important evidence by which you can find out which poison he has consumed. Okay, right. Apart from this, apart from preserving the gastric content, do remember we should also look at the status of stomach mucosa. What is the nature of the stomach mucosa? What is the color of the stomach mucosa? Certain poisons will have specific change in the color of mucosa. We'll discuss about that. Number one, sulfuric acid, H2SO4, sulfuric acid, wherein we get black necrotic stomach mucosa. Black and necrotic because it's charred. Black necrotic or black charred stomach mucosa. It's a very strong acid. You can easily think of that it is sulfuric acid. The next one is nitric acid. What is that nitric acid producing? Nitric acid, wherein you can see yellow color stomach mucosa. Sometimes you can also get that brown color because of the presence of altered blood. Okay, usually it is yellow. Fine. Apart from that, you can think of carbolic acid. Carbolic acid. What is carbolic acid, guys? Carbolic acid is nothing but your phenol. Phenol, the nature of stomach mucosa will be buff white. Buff white. Not only buff white, you can also get leathery stomach mucosa. It thickens the stomach mucosa, leathery stomach mucosa. Right? Patient has come with unknown poisoning. You're doing dissection. The nature of stomach mucosa is leathery. What is the probable poison that he must have consumed? He must have consumed phenol. Okay? Right. Arsenic. You get red velvety stomach mucosa. Or sometimes you can get the white particles. Arsenic white particles may be sticking onto the mucosa. Right? You can easily find it out. Okay. This is one of your repeat question, PYQ. It was asked in one of your JIPMER question earlier. Okay. Apart from arsenic, you can think of your mercury. Mercury is something where you get slate gray mucosa. Slate gray mucosa, very important. So far it has not been asked in the exam. This is very important for your exam. Mercury slate gray mucosa. It will be asked in your exam. Okay, right. The next one is copper sulfate. Not only copper sulfate, friends, even in sodium amytal, copper sulfate, one typical finding that you will notice here, that is nothing but bluish stomach mucosa. Right? This was asked in one of your previous JIPMER exam, sodium amytal, bluish stomach mucosa. Okay, so these are the common finding that you have to see. Common finding that you have to see. Phosphorus. There is one additional point I'll tell you. You can think about that. Phosphorus. Either you get yellow or you can get dark brown. Right? This is an extra H phosphorus. Okay, fine. So I've told you about the smell. I've told you about the color of hypostasis. I've also told you about the nature of stomach mucosa, from which you can find out which poison he has consumed. Okay. The next important step in finding out the poison is you can send the organs for what is called as chemical analysis. You will send the tissues for analysis in the forensic science lab. Either you can call it as chemical analysis, or you can call it as toxicological analysis, or you can also call it as poison detection. There are so many synonyms for this. Everything means the same thing. Right? The reason why we need to know all these synonyms are because you may get any of these terms in the examination. Right? So you should not get confused. Everything means the same thing. Remember friends, the identification of poison in the tissues. Identification of poison in the tissues is the absolute proof of poisoning. Right? Just presence of poison in the stomach alone doesn't mean that he has consumed poison. The poison should have been absorbed, poison should have been detected in the tissues. Then only you can say the person must have definitely consumed poison and he must have died of poison. Okay, it's absolute proof. Okay, now you want to send the organs to forensic science laboratory. What are the organs that you can send? What are the tissues that you will select and you will send? So we'll discuss about that. So when a person has consumed poison, when a person died of poisoning, you are doing autopsy. What are the organ that you will send it to the forensic science lab? Here, this is one area where you will get questions very frequently in the exams. Right? First, let me tell you what are the routine organ that you will send. Then I will also tell you what are the additional organ that you can send in a specific poisoning case. To understand this, first you need to, I'll tell you the concept of this so that you will understand and you don't have to memorize it. Okay. Let us say when a person A, okay, a person A has consumed poison. Where does it go? First, it goes to the organ of food storage. That is your stomach. Right? Then it is absorbed in the small intestine. So you take stomach, you take small intestine. Right? Then the poison is absorbed into the blood. After absorption into the blood, it enters into the liver where it is metabolized. You are taking liver. Okay, 500 grams of liver have to be taken. Okay, then it is circulated in the blood after metabolism. Then finally, it is excreted by the kidney. Right? By the kidney. You can say you are taking the stomach, you are preserving the small intestine, you are preserving the organ of metabolism, that is liver, you are preserving the organ of excretion, that is kidney, you are also preserving the blood sample. Sometimes you can also preserve the urine sample as well. Do remember, these are the routine organs, routine samples. You will send it to the forensic science lab irrespective of whatever poison he has consumed, or you don't know which poison he has consumed. These are the routine organ that you can send. I told you the concept. Organ of food storage, organ of absorption, metabolism, blood, and the excretion, kidney. These are the routine things. Right? When you are sending the stomach, do remember the entire stomach has to be preserved. And when you are preserving the small intestine, do remember the proximal 30 centimeters. Proximal 30 centimeters have to be preserved. When you are preserving the liver, do remember you are preserving 500 grams of liver. When you are preserving kidney, do remember you are preserving half of each kidney, both kidneys, because we don't know which kidney is functional, which kidney is dysfunctional. So you are preserving both kidneys. Right? Blood and urine sample. These are the routine organ that we preserve. How can you remember? You can remember by the mnemonic bloody silk. Right? So this is the mnemonic which will help you to remember everything. What is this bloody silk? B for blood. Right? S for stomach. I for intestine. Which intestine that we preserve? We are preserving small intestine. Right? Liver and kidney. Right? So you remember bloody silk. You remember blood is silk. With that, you can remember the routine organ that you preserve. Okay, fine. Blood, stomach, intestine, liver, kidney. Out of all these tissues, out of the organs which I've told you, which is the best, most reliable is blood sample. The most reliable sample is blood sample. Okay, fine. Going forward, in addition to the routine organs, we can also add some additional organs. What is the concept behind that? It depends on the target organ. If you have a specific poison acting on a particular organ, right, you can add that organ also for preservation. Okay, for that, our classification of poisons will help you to remember that. Okay, fine. So let's see the examples. For example, if you want to preserve heart, in which case that you can preserve heart. Okay, heart can be preserved in case of digitalis poisoning, in case of aconite. These are all cardiac poison wherein you can preserve heart. Wherein we can preserve heart. Okay, right. What about brain? Brain can be preserved in case of cerebral poison. For example, alcohol. You can preserve that in morphine. You can preserve that in any other deliriant, cocaine. Right? Any cerebral poison you can preserve brain. Okay. Spinal cord. In which organ, in which poisoning that we can preserve spinal cord? In which poisoning we can preserve spinal cord? Friends, do remember, friends, I told you earlier, you must be remembering about Strychnos nux vomica. But you should also remember one more poison which I've told you, that is nothing but gelsemium. Gelsemium is also another spinal poison wherein we have to preserve spinal cord. Okay, I told you about that. Then coming to the CSF. CSF vitreous can be preserved particularly in case of alcohol poisoning. If a patient is suspected to die of alcohol poisoning, particularly if the body is decomposed. Do remember, if the body is decomposed, right, the vitreous sample, particularly the vitreous sample, will be very, very useful to identify the alcohol present in the tissue. This is very, very important. They can ask you, in advanced decomposed body is brought for autopsy, right? You're not able to preserve, all the organs are decomposed, you're not able to preserve the organs. Which sample will help you to detect the presence of alcohol in the body? The sample will be vitreous. It's very important. What about lungs? When do you preserve lung? Lung can be preserved in case of volatile poison, any gaseous poison, right? Any gaseous poison. I told you asphyxiants, right? Fine. Hydrogen sulfide poisoning, any gaseous poison, we can preserve lung. Okay, abdominal fat. Abdominal fat can be preserved in case of pesticide poisoning due to pesticide. Even in case of inhalational anesthetics, sometimes we can use abdominal fat. Okay, one very important point I would like to tell you. Do remember, friends, very, very important. In case of metallic poison, particularly in case of arsenic, antimony, thallium, these metals will have the property of getting deposited in bone, in hair, nail, sometimes in skin as well. So the common samples that you can preserve in case of suspected metallic poison, the sample that we preserve in case of suspected metallic poison will be bone, hair and nail. Very, very important. What is the advantage of this? Do remember, even if the body is completely decomposed, if the body is even completely skeletonized, still you will be able to see the presence of bone, hair and nail, with which you can easily find out whether the person was suffering from metallic poisoning or not, which is highly, highly important. Highly, highly important. Okay. So you kill a person by giving a metallic poison, person died, body completely decomposed, body completely skeletonized. Still you will be able to recover the presence of metal in the body, metal in the bones. It's very easy to identify. Okay, very, very easy to identify. Suppose, let us say, person is suspected to die of cyanide poisoning. If it is gaseous, you will preserve lung. That's a different story. But still, one specific organ that you will commonly look for the presence of cyanide, not only cyanide, but also carbon monoxide, that is nothing but spleen. Right? Spleen is usually preferred in case of this. Carbon monoxide and cyanide. Carbon monoxide and cyanide. So we were talking about the organs which are added extra in a case of specific poison. Okay. To summarize, I told you the routine organs which you can remember which you can remember by bloody silk. Okay, blood, stomach, intestine, liver, kidney. I told you how much that you have to preserve. But one more point, if you want to know, extra point, I'll give you extra edge. See, I told you small intestine 30 centimeter, liver half kg, and kidney half of each kidney. This is normally in case of adult. But if you're preserving it for infant, right, if you're preserving it for infant, the whole small intestine, the whole liver, the whole kidney have to be preserved. If it is for only infant. Okay, routine organ is over, and I've also told you additional organs. Additional organs, I told you the key word that you have to remember is the target organ. Depending on the target organ that you can preserve. Okay, target organ. Fine. And I also told you the importance of bone, hair, and nail in case of metallic poison. Right. The point here is you will send the organs in a glass bottle to the forensic science lab. But do remember, you cannot send only the organs in a glass bottle and send it to the forensic science lab because it might decompose, right? So you need to stop the decomposition so that the people will analyze it. How will you stop the decomposition, friends? You need to add what is called as preservative. Right? You need to add what is called as preservative. What are the preservatives that you will add? Right, the choice of preservative is again one very high yield area for MCQ purposes. You will get this particular question in all the exam. You can say NEET, you can say next, you can say INICET. In any of the exam, this area is high yield. This area is high yield. So we'll discuss about that. Right, when we say preservative, do remember here we are technically meaning preservative for chemical analysis. That means I told you chemical analysis, poison detection. We are preserving the organs which we are sending it for poison detection. Preservation, we are not talking about organs in the museum. We are not talking about pathology preservation. We are not talking about that. Here technically we are meaning that we are sending it to forensic science lab for poison detection. What are the choices you have got? You have two important choices. Number one, you have got saturated solution of sodium chloride. You have saturated solution of sodium chloride. Do remember, you cannot just say sodium chloride. That is wrong, right? Saturated solution of sodium chloride, that should be very specific, right? You need to add saturated solution of sodium chloride. Another important option that you have got is rectified spirit. You have got rectified spirit. Okay, fine. Now, this sodium chloride you have also got rectified spirit. If they ask you, rectified spirit is nothing but your 95% alcohol. This is nothing but 95% alcohol. So which is best? Salt is also there, alcohol is also there. Which is ideal preservative? The ideal preservative is rectified spirit. Ideal preservative is rectified spirit, but which is cheaper? Salt is cheaper, that is why it is most commonly used. Right, economical one is salt solution, but the ideal preservative is rectified spirit. So you know the basic concept, but you also need to know they can be asking questions in the place where you will avoid giving salt and where you will avoid using rectified spirit. Fine. Salt is commonly used, that everybody knows, but what is the point where you will have to avoid? That is very important. For you to remember that, I'll give you easy mnemonic to understand. You need to look at the spelling of the word salt, NaCl. Easy to find out, right? Okay. The letter A for aconite. In aconite poisoning, you don't use salt as a preservative. Not only that, the letter C for corrosives. The letter C for corrosives. Do remember, friends, in all corrosive poisoning cases, do know sulfuric acid, nitric acid, oxalic acid, formic acid, all these acids, you never use salt as a preservative except very, very important, except carbolic acid, also called as phenol. What does it mean? What does it mean? It means that you can use salt as a preservative only with carbolic acid poisoning, not with any other poisoning. Do remember, not with any other corrosive poisoning. So this was asked in one of your previous repeat question. One of your exam few years back, you got this question. What is the choice of preservative in a case of carbolic acid poisoning? Carbolic acid poisoning. Right? As soon as people saw acid, they thought salt should not be used as a preservative. It's not so. Only with carbolic acid, you can use salt as a preservative. If they ask any other acid, sulfuric acid, nitric acid, any other acid, you should not use salt as a preservative. Okay. So this is one important point that you have to keep it in mind while you answer preservative in a case of corrosive. Okay, so very, very important. Now moving on to rectified spirit. What are the places where you will not use rectified spirit? Okay, what is basically rectified spirit? Rectified spirit is basically, it is alcohol, right? So if you want to detect dash, you will not use alcohol as a preservative. Okay, yes, yes, alcohol, because alcohol, if you use rectified spirit in a case of alcohol detection, obviously it will give you false positive reaction. So you will not use rectified spirit if you want to detect alcohol. Not only that, you will not use rectified spirit if you want to detect formalin, right? If you want to detect phosphorus, because phosphorus has got some luminescent property. If you add this, that'll if you add rectified spirit as a preservative, that property will be lost. Should not use it. Kerosene, right? Chloroform, acetone. You have other things are there, but these are the common point that you can see and remember for the exam. Okay, fine. Okay, right. So moving further, if you want to preserve blood sample, you have got blood sample, right? For every case you will preserve blood sample. We discussed about that. What are the preservative? How do you preserve blood? Because blood is also more prone for decomposition, right? Fine. You need to add preservative here. What preservative you can choose? You can choose sodium fluoride. Sodium fluoride. You can choose a combination of sodium fluoride with potassium oxalate. With potassium oxide. So very, very important combination. Potassium oxide is an anticoagulant, whereas sodium fluoride will stop the bacterial growth. So you need to add this combination of sodium fluoride, which is very important, along with potassium oxalate. Fine. If you are adding sodium fluoride, you need to add 10 milligrams per ml of blood. If you are adding potassium oxalate, you need to add 3 milligrams per ml. But usually the dose is not asked in the exams and all. You don't have to worry about that. You just remember sodium fluoride is also used and potassium oxalate is also, combination is used. Suppose if you have urine sample, and if you want to preserve urine sample, which preservative that you can use? If you are having urine sample, you can choose thymol as a preservative. You can use thymol as a preservative. If thymol is not there, again you can use sodium fluoride as a preservative. Right? Sodium fluoride is also not there. Toluene can be used. So these are the options we have got. But usually in the exam, thymol is very commonly asked. Okay. Suppose in a case of virological studies, right? Which preservative that we can use? We can use glycerol. Can be used. Okay, glycerol can be used. Right. We have discussed about blood, we have discussed about urine, we have also discussed about virology. There are few cases there is no need of preservative. Why do you need to have preservative? Because it will not decompose. What are the cases where you don't need to have any preservatives at all? I gave you the clue. No preservatives needed. I gave you the clue that it will not decompose. You can easily find out that which organ will not decompose. Bone, if you are preserving bone, there is no need of any preservative. If you are preserving hair, you don't need any preservative. If you are preserving nail, again you don't need to have any preservatives because it will not decompose. Not only that, if you are going to analysis within 24 hours, no need of preservative. Analysis within 24 hours, you don't need any preservative. Not only that, if you're freezing it, deep frozen, the decomposition will not happen, no need of preservative. Okay, so this is one point that you can expect questions in the exam. Okay, fine. Formalin. Guys, formalin. What is that formalin? Can we use formalin in chemical analysis? Can we use formalin in poison analysis? Never. Do remember, never. We should not use formalin in chemical analysis, in poison detection. If you are looking for poison detection, you should never ever use formalin as a preservative, because the detection of poison, the extraction of poison will become very difficult. Poison will be destroyed in the tissues. You cannot find out poison if you are adding formalin in the tissues. When can we use formalin? Formalin can be used if you're looking for HPE, histopathological examination. Only for HPE, we can use formalin as a preservative. If it is for poison detection, you cannot use formalin as a preservative. It was asked few years back in one of your NEET exam. Which of the following is never used as chemical analysis? Never used as a preservative in chemical analysis. Option A, formalin, sodium chloride, sodium fluoride, thymol, glycerol, all these things were given in the option, but formalin should never be used in the preservation of the tissues, which is highly important point. Highly important point.